All right, so in our last explainer, we dug into the science of how scars actually form. Your body's amazing repair process. Now we're getting to the question everybody really wants to know. Okay, let's just tackle this head on. The short answer? No. A scar can't be 100% erased. It's a permanent change to your skin. But, and this is a really big but, you can absolutely manage, improve, and make a scar way, way less noticeable. So think of this as your game plan for doing exactly that. We've broken this whole thing down into 4 parts. We'll kick things off with the first responders. That's the stuff you can do right at the beginning. Then we'll move on to the specialists and what they can do in their offices. After that, we'll talk about the heavy hitters, the architects of surgical fixes. And finally, we'll pull it all together with the strategy for your own personal plan. First up, the first responders. Seriously, what you do in those first few days and weeks after an injury or surgery is so, so important. This is where you lay the groundwork for the best possible outcome. It really boils down to 3 key things that anyone can do at home. These are scientifically backed steps that give your healing skin a real fighting chance. So let's look at each one. Let's start with silicone. When you put a silicone sheet or gel on a new scar, it creates this hydrated, breathable little environment. This basically sends a signal to your skin to just calm down. It tells it to stop going into overdrive with collagen production. The result? It helps keep the scar from getting all thick and raised. It's a go-to after surgery for a very good reason. Next is gentle massage. Now, once your wound is completely closed and you've gotten a green light from your doctor, massage can work wonders. You're physically helping to break up and reorganize all those dense collagen fibers that are forming. This doesn't just make the scar more flexible, it really encourages it to heal flatter. And our last one here is an absolute deal breaker: sun protection. Brand new scar tissue has 0 defense against the sun's UV rays. If it gets exposed, it can trigger this massive pigment response, and you can end up with permanent darkening. That's called post-inflammatory hyperpigmentation. So keeping it covered or slathering on SPF 30 or higher is a must. No excuses. So what happens when that early at-home care isn't quite enough? Or maybe you're dealing with an older scar. Well, this is when you call in the specialists, your dermatologists and plastic surgeons, who have a whole arsenal of treatments. But first, we need to know what we're dealing with. A hypertrophic scar is raised, yeah, but it plays by the rules. It stays within the original boundary of the wound. A keloid, on the other hand, is much more aggressive. It's an overgrowth that spills out and invades the healthy skin around it. Knowing the difference is key for picking the right treatment. For both of these raised scars, corticosteroid injections are often the first line of defense. A specialist injects a steroid right into the scar tissue. This reduces inflammation, stops the itching, and basically tells that collagen factory to shut down. It's super effective and can flatten a scar by more than half, but you usually need a few rounds of treatment. Lasers are an amazing tool because they're so versatile. You have different lasers for different jobs. Some are great for zapping the redness in new scars by targeting the tiny blood vessels. Others are what we call resurfacing lasers. They work by removing the very top layers of skin, which smooths out the texture and encourages fresh, new collagen to grow back in a much more organized way. But what if your scars are sunken in, like from acne or chickenpox? Here, the goal isn't to break down tissue, it's to build it back up. And that's where microneedling is brilliant. It creates these tiny, controlled punctures in the skin. This tricks your body into launching its healing response all over again, producing new, healthy collagen that fills in those depressions from the bottom up. Now, for scars that are really big in a prominent place or even limit your movement, sometimes we have to take it a step further. And this brings us to the architects, surgeons who can literally rebuild and restructure a scar. It is so important to have realistic expectations here. The goal of surgery isn't to make the scar vanish into thin air. The goal is revision. You're swapping out a big, noticeable scar for a new, carefully created one that's thinner, better placed, and way less obvious. Surgeons have a few main techniques they use. Let's take a quick look at 3 of the big ones: scar revision, a really clever method called a Z-plasty, and a super important one called a contracture release. Okay, the most direct approach is a scar revision. You can think of it as a surgical do-over. The surgeon just cuts out the old, badly healed scar tissue, then they use really precise stitching techniques to close the new incision, designing it to heal as a much finer, cleaner line. This is where surgery gets really artistic. A Z-plasty is just ingenious. Instead of one straight cut, the surgeon makes Z-shaped incisions to create these little triangular flaps of skin. Then they rearrange them. This does two amazing things. It breaks up that obvious straight line of the scar, and it releases the tension on the skin, which helps prevent the new scar from widening. Sometimes treating a scar is all about function, not just looks. A contracture scar, which you often see after bad burns, is when the scar tissue tightens up and literally pulls the skin, making it hard to move a joint. A contracture release surgery cuts that tight tissue, freeing up the joint and giving a person their range of motion back. It can be life-changing. Phew, okay, we have covered a whole lot of ground, from simple creams to complex surgeries. So how do you figure out what's right for you? This brings us to our last section, the strategy, your personal playbook. The whole key is to match the solution to the problem. It's pretty logical when you think about it. If a scar is sunken, you want to build it up. If it's raised, you need to flatten it. And if it's tight, you've got to release it. Each type of scar has a go-to set of treatments that are designed to fix its specific problem. And please remember this. There is no single best treatment for all scars. The right plan for you is totally personal. It's going to depend on the scar itself, your skin type, your age, and, of course, what you're hoping to achieve. Which brings us to the single most important piece of advice in this entire explainer. Before you do anything at all, you need to see an expert. A board-certified plastic surgeon or dermatologist is the only person who can properly diagnose your scar and create a treatment plan that is both safe and effective for you. You know, scars are often thought of as just a record of the past, but with all the incredible treatments we have today, you really do have the power to help write the next chapter of that story. So the question isn't just about healing what's happened, it's about deciding what comes next for you and your skin.